Respiratory rate is such an underrated vital sign, and I will show you a quick and easy way to determine it using just pulse oximetry. But first, why is respiratory rate so important to get? Think of respiratory rate as the result of the body of your patient constantly doing blood gas analyses to control the pH. And any state that will lower your pH, like sepsis, hemorrhagic shock, distributive shock, any shock, ketoacidosis, anything that lowers the pH will, even in an early stage, lead to an increase in respiratory rate. And also other conditions, pulmonary conditions like pneumonia, pneumothorax, will lead to an increase in respiratory rate. But also psychological conditions like fear or excitement. So respiratory rate doesn't tell us what is wrong, but it tells us that something is off. And when we talk about the numbers, we don't need to freak out about the exact number. All we want to know is the respiratory rate normal or is it abnormal? And if so, is it just a bit increased or is it super high? So a rough estimate will do. But if we don't measure it, we don't really think about it, and then we don't acknowledge its importance. In practice, someone has to take a stopwatch and count the breaths of the patient for 15 seconds. Is that practical with a crashing patient in front of you? Or you take out your phone and tap on an app in rhythm with the breathing of your patient. But tell me, are you using clean gloves to do so? Or will you wipe off your phone afterwards? There is a much easier way to get the respiratory rate. Let me show you. An easy way to determine the respiratory rate is just to use pulse oximetry. Chances are high you already have your pulse oximetry on your patient already, so all you need to do is turn on the sound of the pulse synchronous blips. And once you have that, all you need to do is just monitor your patient. Watch your patient and count the number of blips during a respiratory cycle. So we get pretty much to a count of 6 blips per respiratory cycle. My heart rate was pretty much around 80. So my heart rate is 6 times as fast as my respiratory rate. So if I want to know my respiratory rate, I divide my heart rate, which was about 82, by the 6 I counted, which gets me to 14, which tells me my respiratory rate was 14. So a quick summary to determine the respiratory rate: take pulse oximetry, turn on the sound, watch your patient, and count the number of blips during one respiratory cycle. That number tells you how much quicker your heart rate is. So divide your heart rate by that number and you have your respiratory rate. I hope that was helpful. If so, please share it and like it. I can't find any mentioning of this method in literature. So if you've heard of this method before, let me know in the comments. And how do you measure respiratory rate? Enjoy your day and thanks for watching.